question would be, let's name the organ. The liver is easy. On some of the other ones, we'll go move on to, it will be a little more difficult, but I'll give you all the tips. Okay. So the liver is organized into lobules. This is sort of like bone, where we saw osteons. Okay, so the liver lobule is this sort of geometrical shapes, usually like looks like a hexagon or a pentagon. Okay, and the liver has a bunch of these. So if you move around, you should be able to see another one. That's part of the one, wrong way. There's another one. Let's go back to that one. It's pretty decent. Okay, and so in between the liver lobules, there is some connective tissue. Okay, and in between the liver lobules is where you're going to find the hepatic triad. Hepatic triad is a group of 3 structures: an artery, a vein, and a bile duct. Okay, the liver is specialized to cleanse blood. That's one of its many functions. And so we do have blood vessels running through the liver tissue and also at the edges of the liver lobules. So hepatic triad, central vein. All right, let's do the central vein. So here we've got the central vein right in the middle of the lobule. This is where we have the hepatocytes. The hepatocytes are all inside of the lobule. So let's zoom in on that. You can see the nuclei of the hepatocytes kind of stand out, those little tiny circles. Here's your central vein. Here's the hepatocytes. You can see some white spaces in between, mostly white, I guess, not all. Some spaces in between, kind of little snakes or little streams. These are the sinusoids. These are little veins. Remember, a sinus is a big vein, so these are little veins that are going through the liver tissue. This is how the liver cleanses blood. It has all these extensive sinusoids going through. You actually can see some of the red blood cells in as well. That's what that is. Okay, so the hepatocytes are these. You can see the round nucleus. Sinusoids are these. Central vein is that. So now if we go to the side and we look at the in-between connective tissue, we are looking for a group of 3. That one's kind of funky, kind of spread out. All right, let's go to this one. Usually it's 3, sometimes it's more. Okay, the vein, you don't have to actually identify them individually, so I want